So, Dr. Frieden, if I'm correct, port wine stains is capillary malformation. And can you tell us more about how it could be treated?
The talk that I gave at the plenary session was about the term port wine stain, about trying to distinguish between different types of port wine stains. And that's very important to decide how they should be treated, because the ones that are capillary malformations, the first line treatment is with pulse dye laser. And that can be a very effective treatment in partially removing the stains and occasionally getting rid of them almost completely or completely. However, there are other things that mimic the capillary malformation look, but that probably are not the same thing. And what we now know is that they actually have different causes in terms of the mutations, which really you can think of as programming errors in the way the skin develops. And some of them are caused by genetic mutations in the skin that can involve underlying tissues and that can cause what we call overgrowth or expansion of the size of the tissue, varicose veins, dilated veins. Others have more artery feeding the skin so that it looks a brighter pink color. And those are not as amenable, those other types are not as amenable to pulse dye laser treatment. So part of the point of my talk was that these genomic insights, the insights into the causes, can be helpful in the future in finding targeted treatments, because these are genes that are activated in other diseases, particularly in cancer. And we have cancer therapies that can probably be repurposed for the use in these birthmarks, to either rub directly on the skin, to inject into the skin, or to give even orally in certain cases where there are complications from some of these port wine stain type birthmarks.
Mm-hmm. And should they be treated immediately after birth when they show signs?
Well, most of them are present at birth, and the decision about whether to treat depends on many things. First of all, location. If a very prominent birthmark is on the face, that's a very good reason to treat, because you don't want people to be stigmatized by these birthmarks. Mm-hmm. If they're on other parts of the body, they may or may not need to be treated. If they're in a very covered area, we'll often, and particularly if they're very large, we will often wait until a child is older and let them make a decision about whether they want to try something like laser. And then there are other ones where the treatment would best not be something like pulse dye laser, but whether there may be medications in the future that will be helpful for treating those. So the timing is important in some respects, but it really depends again on which specific type of birthmark we're talking about.
Okay, so then one last question. Are port wine stains found in bloodline, in family bloodlines?
Right, that's a great question. And it's one that parents worry about. For the most part, they are not hereditary, even though they are genetic. But the genetic changes occur in the fetus rather than being passed on from the parents to the child. But there are certain birthmarks, and particularly ones known as capillary malformation AVM, which are the ones that have a higher blood flow, that definitely can be passed on. And the clues to those are that there are often more than one of them. In other words, instead of just having one port wine stain, you have a lot of little ones and maybe one bigger one. So that would be a big clue that it could be a familial condition.